Hey everybody, and welcome to Tales from the Clinic. This is a new podcast hosted by Dr. Molly O'Banion and myself, Ashley, just a regular gal. The premise of this podcast is all things pets and veterinary medicine. Dr. Molly is here to do that part. I am here to make sure she's using words us regular people can understand. Each episode we will dive into different aspects of veterinary medicine, interesting cases seen at the clinic, and just general advice on pet ownership in hopes of educating and giving a glimpse into our world. So, let's get started. Hello, everybody. Welcome back. I'm struggling. I got a lot going on in my life. After this episode comes out, it'll be 2 days before my wedding. In addition, we were voluntold to take a dog. She's a cute dog. Her name is Ladybug. But your cat's only loving friend, Ashley, here, has a dog now. She's 8 months old. It's a hostage situation.
It's a hostage situation for Ashley, not the dog.
Correct, yes.
Ashley is the one that's being hostaged.
Yeah. Ladybug's having a great time. Such a great time that she actually set us up perfectly for this episode.
Yes.
She has, obviously, puppy. She was a stray, we think abused and abandoned, and then she wandered up on my fiance's property. So no training. And what that involves, well, I think this is all puppies, they eat everything. Everything belongs in their mouth.
Also, you're so used to cats who train you, you don't actually train anything, and now you're having to train a puppy.
It is exhausting.
And she's an energetic puppy, not like a lazy, she's not like a spaniel. She's
Yeah.
like a Wawa.
She's a Chihuahua, possibly terrier mix based on the incessant barking. I don't know. It's rough.
She's cute.
She's cute. I'll post a picture so y'all can see her. She's got some fancy eyebrows. Along with all the chaos that she's been causing in my house and pissing off my cats,
They deserve it.
They do. They deserve it a little bit. They need to toughen up. But the lovely little lady, sniffed out our grease trap that was in a random remote corner of our garage and decided to be a party girl and took a shot of the grease.
Woo woo!
Thank my lucky stars. She has not gotten pancreatitis yet. She hasn't even had diarrhea yet, which I'm shocked. But I guess being the super stray survivor, she came to us skin and bones. I'm assuming her system has been through a lot. She might be a bit of a tank, which would be great. Although now I might be expecting a foreign body at some point in her lifetime with how she acts.
Probably.
So, thank you to Ladybug for setting us up and getting us focused for today's topic of pancreatitis.
And giving you practice for human children, if those ever come.
Get that out of your mouth!
It's perfect practice because guess what? They are the same.
This is exhausting.
Except Ladybug can't talk back to you and loves you unconditionally. Human children are not that.
Oh, gosh.
Okay.
So, pancreatitis.
Pancreatitis. It's a good time of the year to talk about pancreatitis too, because this is the time where everybody's, busy with family, not paying as much attention. We've got the dogs counter surfing. We have lots of good food around. People feel bad because they're like, we're eating this yummy meal. And what's his name? Puff
Floofs.
Floof?
Puff Puff.
Floof is in the corner staring at us with those big sad doe eyes, and we must share.
We must give Floof a turkey leg.
Because we love him by feeding him. And so let me tell you something. Public service announcement number 1. The week after Thanksgiving, we will have 10 of these.
Yeah.
Per location.
Yeah.
Same with the week after Christmas. We will have many. So, here's your warning to do better.
That's all you get.
That's all you get. All right, so pancreatitis. People get pancreatitis too.
Mm-hmm. Painful.
Yeah, not fun. Okay, so pancreatitis. Not only dogs can get it, cats can get it too, but I generally see it more frequently in dogs.
Yeah.
Like, yes, I have cats that have it, but not me. I don't have cats. I have patient cats that have it.
Do you want a dog?
No, but I see it all the time in dogs. I see it moderately in cats. How about that?
Yeah. And
It's middle.
size-wise, doesn't matter. Does it seem like more common in smaller dogs versus bigger dogs, or?
No, I see it in all. But there is a breed that when it walks in the door and it's vomiting diarrhea, we literally say, "Oh, you have pancreatitis," before we even shake their hand and meet them.
Which one is that?
Schnauzers.
Oh, yeah.
They're born with it.
Oh, stressful. Yeah.
Literally, every single schnauzer that walks through the door that has GI issues, I'm like, all right, I'm running a pancreatitis test on you, and it's coming back positive, and then we're going to talk to your mom about how to fix it.
Start making an estimate.
Right, start making an estimate. Because it's, like I said, they're born with it. It's kind of like King Charles Cavaliers and heart disease. I don't know of one that hasn't been affected, which is horrible and really sad, but it's the truth.
Yeah.
Okay, so let's talk about pancreatitis. Do you know which organ it comes from?
Which organ? The pancreas.
Good! That's an A+. Do you know what the pancreas does?
Something with sludginess?
No!
I know the gallbladder does it, but maybe there's a different kind of sludge.
No!
Oh. Wait. No.
Perfect. So the pancreas is it's an organ, but it's a really little organ.
It's just a baby.
You could consider it imaginary, but it's not. Right? Yes.
Okay.
It sits in the mesentery, which is like the fatty connective tissue, and it hugs the duodenum. So when you exit the stomach, the first piece of small intestine is called the duodenum.
Oh.
And the pancreas sits along the edge of the duodenum, and it like snuggles.
Oh, okay. I got you. Like,
and it's
a good pillow.
Yeah. It kind of looks like a columbinous cloud, but pink. What? It kind of looks like the stuffing out of pillows, but less fibrous and pink.
Okay.
It doesn't have it's not, this is hard. It's not like a normal shape. Like when I say the word liver, you can imagine a liver. When I say the word stomach, you can imagine a stomach. The pancreas is just kind of it's like a flat.
The thing in my head is imagining a pregnancy pillow with a woman on it.
Kind of.
Yeah.
But less round.
Less round. More fluffy, but not fluffy.
Yeah.
And pink.
Yes, and pink. So what it does is it is responsible for creating a lot of digestive enzymes, and then they go into the small intestine and they help you digest things.
Oh, yes. In humans, it can be removed because it was originally for processing the ingestion of bone.
What?
I don't know.
No.
Oh.
You cannot remove your pancreas.
What's the thing that ruptures that you don't need?
The gallbladder.
No, there's something else.
The appendix?
Yes.
Okay. Not the same thing.
Is it pink?
Oh my god.
Okay.
Gosh.
Maybe we'll delete this part. Anyway.
One of the most common things that we associate the pancreas with is diabetes. This is a lot of cat issues. So when cats get pancreatitis, it makes them super prone to diabetes because their islet cells cannot produce the insulin or cannot access the insulin the same way.
Gotcha.
The pancreas makes the insulin.
Okay. Gotcha. Yeah, don't remove that.
No, don't remove that. That's why I'm saying you can't remove the pancreas.
What are you talking about, Ashley?
So in dogs, when dogs become diabetic, because dogs are more like a type 2 diabetes in people, when dogs become diabetic, it can make them more prone to getting pancreatitis, but they can get pancreatitis without being diabetic.
Okay.
Cats, kind of the same, but if cats get pancreatitis, they're more likely to become diabetic.
Okay. Interesting.
Does that make sense?
Yeah.
Kind of?
Yeah.
Kind of. Because cats are more type 1 than people.
Yeah. Huh.
Yeah. But cats also, okay, fun fact. We haven't done diabetes. We should. Cats can revert. So if a cat becomes diabetic, a cat can become undiabetic. Amazing. Also, pain in my butt.
Also, We did that with one patient, didn't we?
I do it with lots of them.
Oh, okay.
It's a pain in the...
Pain in the butt.
But it's cool. I mean, I wish people could do that.
Yeah, that'd be nice.
But we can't. So, moving on. Pancreatitis is essentially inflammation of the pancreas.
Mm-hmm.
When the pancreas gets inflamed, it can't do its job the same way, and you start having mainly GI issues. So you start having vomiting, diarrhea, you're not absorbing things. They can get gastric ulcers because they can't hold anything down. They can get dehydrated really easily, all of that fun stuff. What usually spurns it on is high-fat diets. So this is where your table scraps come into place. So anything with oils and butters and all of that kind of stuff. If you baste your turkey in grease...
It's delicious, but dangerous.
Yes. Rotisserie chickens. People think the rotisserie chickens are just baked. They're not.
Yeah, well, when we say boiled chicken breast for a GI-friendly diet, we're saying boiled chicken breast for a reason.
Yes. Yes. Because when you rotisserie a chicken, you are basting it, and then it's very greasy, and then you're giving it to the dog, and pancreatitis mama.
Yeah, even if you take the skin off, not good enough.
Not good enough.
It bakes into the meat.
Mm-hmm. Not good enough. Pancreatitis can have different, I'm going to call them phases. So you can have like an acute pancreatitis, which is in the case of your schnauzer ate a piece of rotisserie chicken and its pancreas got pissed.
Yeah.
And then you can have a chronic pancreatitis, which is like that schnauzer now is prone to getting pancreatitis multiple times and it has it throughout its life.
Yeah.
And you have to like manage it.
Yeah.
You also can have what's called a necrotizing pancreatitis, which those are the really fun ones. It's where the pancreas gets so inflamed that the cells of the pancreas start dying.
Ooh.
That's not good. Those are very challenging to overcome.
I feel like I've seen a few of those since I've been here.
Yes, and they're ugly.
Yeah.
They're ugly. Usually with those, you can start getting like the coagulation issues where you start bleeding from all your orifices and all sorts of fun stuff.
Gotcha.
Not good. If you have a chronic pancreatitis child, and we see this a lot in like the larger breed dogs, so like your shepherds and your labs and those kinds of guys, you can also get what we call EPI, or exocrine pancreatic insufficiency, which is where you have to supplement pancreatic enzymes in their diet because they don't make enough anymore.
Oh, and
or they can't digest their food. And then they have like chronic diarrhea and they lose a bunch of weight.
That's sad.
Yeah, it's lovely. And those enzymes are not the cheapest thing in the world to supplement with. Also, you want to know something fun?
Yeah.
There are multiple insulin types that are created from insulin from pig pancreases.
Of course they are.
That's crazy, right? I don't know who's going in there and like collecting the insulin from the pig pancreas, but that's not me.
That's not me either.
And I don't want it to be. Just for the record. Okay, so how do we find pancreatitis? How do you do it? How do you do it? How do you do it? How do you do it?
Blood test.
Yes, that's where I usually start. And every doctor is different in this. You know, some people don't trust the pancreatitis blood test. Some people prefer imaging. I prefer both. But also, like, if you have the clinical symptoms and the history and a positive pancreatitis blood test, if it quacks like a duck and it walks like a duck, it's probably a duck.
Yeah.
Right? Like, come on.
Yeah.
So that's kind of where I'm at. If it's a chronic one, that's when I really say, like, okay, I need an ultrasound because I need to know, like, how bad is it? Also, is it a tumor? Is it necrotizing? Is it, like, it's more, I need more in-depth information.
Right. Almost like there's a secondary thing going on.
Right. Like, why do we keep having these symptoms? How bad is it affected? Should we be nervous about things like the EPI or the diabetes in our future? Like, there's a lot of questions that I can answer with that imaging that I can't just answer from blood tests.
Yeah.
Okay. So we know that it's pancreatitis. Now what?
Hospitalized. I know fluids, medications. I know one of them is gabapentin to help with pain. The rest, I don't pay attention.
Perfect.
GI sensitive diet. So the Hills ID is what we usually do. Low fat. And then they hang out with us. And we monitor vitals. And we say, do better.
Do better. We're rooting for you.
Yeah.
Can I say something?
Yeah.
It depends.
Oh.
I mean, yes. A lot of them I recommend fluids because not only are they losing fluids with their vomiting and diarrhea, but the fluids also help to kind of flush everything out, support them. It's better. And if they're actively vomiting all the time, you can't send them home on pills.
Yeah.
That makes no sense. You're going to give your dog a pill, it's going to vomit it up, and it's got nothing.
Yeah.
You know?
Yeah.
No. So if we put them on an IV catheter and we put them on fluids, we can start them on injectable medications until they stop vomiting, and then we can send them home on pills.
Nice.
Yes.
Yeah.
If it's one of the more chronic ones and they're having a small flare, sometimes we don't need the full hospitalization.
Okay. Probably what Ladybug would have done if she decided.
Yeah, I probably would have sent you home with sub-Q fluids, which would have been really funny to watch.
Yeah, no.
That would have been greatly entertaining.
Oh, I will say a quick interjection, because I texted you I called you right when she did that, and you told me to feed some bread. That seems like it did help.
Because in my head, and I don't know if it actually works or if it's a placebo for y'all to make you feel better, but in my head, the bread it's kind of like a toxiband. It's going to absorb some of the...
That's what I figured. And she decided to do this at 9 o'clock at night. That was great.
Yeah. I mean, at that point, the bread's not going to hurt anything. It can only help. So
yeah.
Do not do it all the time. If you have access to a vet clinic, that's probably the better. But if you don't,
yeah,
a piece of bread's better than nothing.
Yeah. And I just gave her like half, because for her size, she's like 12 pounds, I think. I gave her like half a slice of bread. I was going to go for a whole one, but I was like, that expanded her stomach a lot.
Yeah.
So, but oh well. She's alive now.
I cannot stop imagining you trying to give her sub-Q fluids at home.
Oh, gosh. She's got the skin for it.
Yeah, but I feel like you would have to be like sitting on top of her, put her in a straitjacket, and still be playing Twister. Yeah, this would be fun for me. Not for you.
This is a horrible decision. And a week leading up to the wedding. I can't. I can't.
It's perfect!
No.
Okay, so fluids, whether they're sub-Q at home or IV, supportive medications to stop their diarrhea, stop their vomiting, get them eating again. We need them to eat so that their pancreas starts producing more of the enzymes. It has to kick it into gear. We need to support their hydration status. We need to make sure they're comfortable because pancreatitis is very painful. I'm talking really fast, but I'm going through a checklist in my head. We didn't used to have this. It's fairly new. Now there is a drug called Panaquel.
Yes.
Are you ready for the fun game?
No.
I'm going to have you pronounce the drug name.
Perfect.
Here you go.
Oh, hold on. I gotta bring my mic with me. Fuzaplatib. Sodium.
Sodium's right.
Sodium's right. Give it another shot. Fuzaplatib.
That was decent.
Fuzalavid.
No.
Nope, that got worse.
It's Panaquel. It's Panaquel.
How do you pronounce it?
I'm pretty sure it's Fuzaplatib.
Fuzaplatib.
Sodium.
Sodium. I know the salt part.
Okay, are you ready for this? It is a leukocyte function-associated antigen 1 activation inhibitor.
As is tradition.
Yes.
Of course. That's what I learned.
Everything.
Art history taught us about that.
Perfect. I'm glad you didn't skip that class. Essentially what it does is it blocks the neutrophil-mediated inflammatory response. So neutrophils are like the infantry of the white blood cells. It's like those are the ones that like go in first.
Okay.
And you're limiting those so that you can limit the overall inflammation, which in theory makes you heal faster, decreases your symptoms faster, and prevents or helps to prevent it from becoming a chronic issue.
Gotcha. Okay.
So this drug is best used in our acute cases, and it's best used in the first couple of acute cases from that single patient. If you have like a chronic kid, they probably have like scarring and stuff, and I don't know if you're going to get like the full effect from it.
Right.
If you have, the schnauzer that comes in and it's a 2-year-old schnauzer and it got into the rotisserie chicken.
Again.
For the first time. For the first time. this would be excellent because hopefully we can keep him from becoming like all of his cousins.
Gotcha. Okay. And this is if I remember, it's an injection?
It's a series of 3 injections.
3 injections.
And they have to be given IV. So this is like one of those cases where we need them to be on IV fluids so that we can give, and you give them once a day for 3 days.
Okay. Gotcha.
I have done a couple cases where the dogs were doing significantly better. So I had them on IV fluids for like 2 days, and I gave the first 2 doses, and then I sent the dog home because it was
fine.
And then the owners came back on that 3rd day for me to give this last injection IV, and then we pulled the catheter, and they were good to go.
Okay.
But if the dog's not doing well, then it's probably going to be on 3 days of fluids anyway.
Yeah.
You know?
Yeah.
You feel me, Vern?
I don't know that reference. Who is Vern?
I'm pretty sure it's Laverne and Shirley.
Nope. No idea what that is.
Showing my age. I hung out with my grandmother a lot. Leave me alone.
Oh yeah, I've got pictures.
Leave me alone. Leave me alone. So the Panaquil is not the cheapest thing in the world. It's actually super expensive. But I do feel like it helps. And our ultrasonographer, he's a brilliant man. He says that since it's come on the market, he has visibly seen the changes in the acute pancreatitis cases, like on his ultrasound machine. Like he can tell.
Cool.
Yeah. And so that to me, that's good enough.
Well, and it's also especially when it's really bad cases, like this can be lethal.
Yeah.
And I feel like since I've started working here and since that Panaquil series has come out, I don't know if this is a word, the lethality of it.
Oh God.
Has
the mortality.
The mortality rate has dropped pretty significantly.
I feel like so too. They came out, when they came out with this, it was around the same time as they came out with that parvo monoclonal antibody shot.
It was, yeah.
Yeah, and people get them confused. I get them confused in my head. Not because I don't know the difference. I absolutely know the difference. But the Panaquil for the pancreatitis is 1 injection once a day for 3 days. The parvo one is only 1 injection once. And that's the part that I'm like, is this the 3-day one or the 1-day one? I can't remember. But I do feel like both of them, they came out at the same time. They both start with P's. Yeah. They're both like
game changers.
Yes.
Yeah.
Yes. Like they made a huge difference in these very sad cases that we see all the time.
Yeah.
They're starting to use that technology in a lot of other areas of our field too.
Cool.
So they're doing like cancer immunotherapies. They're doing, the Cytopoint, the one for the chronic allergies.
Yeah.
They're doing the ones for the arthritis, the Solensia and the Librela.
Mm-hmm.
And there's other ones that I'm not allowed to say that I've been taking surveys on that are coming out too.
Cool.
Yeah. So that might be our future. Your dog's sick? That's fine. Go to the vet and get 1 IV shot and it'll be fine.
That'd be great.
Is that how robots take over our job?
No, because we'll keep podcasting. We'll keep podcasting.
Yeah. We'll just talk about the robots.
Yeah, because this pays the bills.
All $0 we've made from it. Actually, I think we're in the negative because we bought the microphones. Okay, do you want to know prognosis? Here's my numbers. Ready?
Yes.
In a study of 138 dogs with acute, this is the acute ones, 33% died within 30 days of diagnosis. Yuck.
Whoa.
That's a third. That's not great. Higher bilirubin concentrations, elevated kidney enzymes, and abnormal electrolytes were all associated with this short-term mortality rate. So the less other organs are affected, the better chance you have, which makes sense.
That makes sense.
Yeah. And I think this study was probably before Panaquil, is my guess.
It sounds like it.
I'm pretty sure. Another study said that, oh, that's ugly. So another study said that the dogs that showed the higher pancreatic enzymes on our CPL test, like higher than 10, which is pretty high, were 5.3 times more likely to die than less than 10.
Wow, that's a big jump.
That's ugly. That is a huge jump. I don't like that at all. I don't know how often I see that high of a level, though. Also, I feel like that's probably before Panaquil. Like, Panaquil really does make a difference.
Yeah. So obviously, like dogs and cats, but let's say we're just talking about dogs, they can have, just like an upset tummy. There might be like a vomit, maybe diarrhea for a few days. Try the pumpkin, bland diet, and it'll pass. But I would be worried that if I tried that for 3 days and it didn't improve, and so I was like, okay, definitely time to go to the vet. 3 days if it's pancreatitis is dangerous.
3 days of pink titties. I think that you have to use your best judgment. I think that if you try it one day and the dog is getting worse, or the cat, they're getting worse, like diarrhea is starting, the vomiting is getting more frequent, they're not eating anything, like, don't play.
Okay,
Go to the vet. If you're trying it and they're getting better,
yeah,
okay.
Give it another 24 hours.
Yeah, make sure that they're staying hydrated. Also, about the Panaquil, just side note, we can't use it in cats yet.
I figured. I don't remember us being able to yet.
No, but I'm hoping that they get there, because the cats are the ones that, like, it leads to diabetes and stuff pretty frequently. So I really want them to. I feel like cats don't get anything. Like, we don't have any drugs for cats that are the same. Like, we have Silencia. Lame. You can't use Cytopoint in them. You don't use the Parvo shot in them. You don't use the Panaquil shot in them.
I have a theory. Conspiracy theory. It's because cats are trying to take over the world, and you vets are trying to keep that under control.
That's probably true.
That's probably true.
We can't save them. If we save them at too high of a rate, then they'll overcome us.
And that's dangerous.
That's horrible.
Everywhere.
That's horrible. That's horrible. Maybe it's just, no, it's because of their immune systems. Because they're so
hardy.
Catty. I can't. Hopefully they're working on that. Somebody figure that out. Make Panaquil feline. No, it's because their pancreas is just so different. Everything's different. They're aliens.
I could see that.
Okay. That's all I have. Pancreatitis. You don't want it. It's bad. It's painful. It can be expensive. Don't do it.
Yeah.
Boiled chicken. Boiled chicken, steamed veggies. Your dog doesn't know the difference. I promise.
Yeah. And I've seen it before in the past. I understand Thanksgiving is fun, and we don't want you sharing the goodies on your table with your animals, but there are a ton of recipes out there that are like pumpkin-based things, peanut butter-based cookies. Make sure there's no xylitol, like we said last time. But like, there's ways to make them feel included.
Yeah.
You just do your research.
Yes.
If it's cooked with oil, 100% do not do it.
Don't do it.
If it has sugar, 100% do not do it.
Butter.
That's for your mouth, not their mouth.
Don't share. That stuff's good.
Yeah. Big time.
Most dairy is too fat.
Yeah.
A tiny amount of cheese every once in a while, okay. But don't feed your dog yogurt and sour cream and ice cream and no.
Yeah.
No.
What's the deal on pup cups?
Pup cups they're just like frozen bananas and stuff.
What?
Yes.
Starbucks serves frozen bananas.
No, that's whipped cream.
That's whipped cream. And that in too much could be very bad.
Yes, because it's sugar.
Okay.
But like they make these pup cups like that you could buy at H-E-B and stuff that are just like frozen bananas and peanut butter.
Yeah.
Hopefully they pick the peanut butter that doesn't have xylitol.
Yeah. And I know they, this is more of a summer thing, but looked up the like low sodium like beef broth or chicken broth, freeze them into ice cubes. They get a little popsicle.
Yeah, delicious.
Delicious. Well, I guess in Texas it doesn't really matter. You can do it at any point in your life. Delicious. So, but yeah, that was a quick little tidbit as we get into my personal favorite holiday. The next episode after this one is technically supposed to be on Thanksgiving Day. So we are going to take a break to be with our families. For you guys to be with your families, we will be back in a month for another episode. We'll see what that one is. We're still oscillating between ideas.
Oh, that was a big word.
You like that?
That was a big word. I'm so proud. Are you growing?
No.
Oh.
I'm still 5'3". But we hope you have a wonderful Thanksgiving. Next time I talk to y'all, I will be a Mrs. instead of a Miss, and hopefully have a little bit more wrangle on this dog I have in my lap.
Probably not.
Probably not, but, we wish each other luck. We hope y'all have a wonderful Thanksgiving, and we'll catch you next time.
Make good incisions.
Thank you for joining us on Tales from the Clinic. Again, we are your hosts, Dr. Molly and regular Ashley. For more insider scoops into the vet med life and pet ownership, hit that subscribe button for updates on new episodes, and of course, share our channel to spread the word. Check the podcast notes below to see how you can get in contact with us. You can find all of Dr. Molly's affordable pet healthcare clinics on social media as well. Thanks again, and talk soon.